Hi, I'm Dr. Mike Hoaglin. I'm a physician specializing in emergency medicine, and I'm one of the telemedicine doctors for Oscar members. Today, we're taking it to street level and going to talk about some of the basics of first aid on the go, from cardiac arrest to friction blisters. Whether you're stuck in a crowded event such as a protest or out in the wilderness, a few simple tips could go a long way to avoid further injury. Now, whenever we talk about injury, ABCs come first. That's airway, breathing, and circulation. If someone is not breathing, they're turning blue and/or has no pulse, determine whether you're able to safely perform CPR. If you are certified in CPR, you might even be prepared and carry a mouth guard on your keychain. Whether or not you know CPR, if someone you come across is unresponsive, don't just step over them. Look, listen, and feel to check to make sure that they're breathing and have a pulse. If they don't, you should tell someone to call 911 in order to activate EMS, and you or someone qualified should begin chest compressions. If you don't know CPR, the dispatcher can walk you through it. And you should consider becoming certified through the American Red Cross or the American Heart Association. Now I'm going to go over some specific injuries and how to help and protect yourself. We'll talk about crowd control, skin, musculoskeletal, and heat-related injuries and illnesses. First of all, it's important to remember to not go out alone. The buddy system is important, so someone has your back in case things go south. Now first we'll talk about crowd control situations. There are certain devices that can be used that can cause injury. We'll start with projectiles, such as rubber bullets and tasers. These are typically used to cause temporary pain and disability, but they can lead to serious injury and worse in certain situations. It's important if these are being used around you to wear eye protection to prevent orbital injury and eye injury. These projectiles can cause facial injuries as well. Now, get away if they're being used close around you, because point-blank exposure can lead to eye, head, and organ injury. More commonly, hematoma or bruising is common, more superficial injuries, but traumatic brain injuries are certainly possible. Tasers are also used to incapacitate people. They normally do not cause injury, and they rarely cause cardiac arrest. But to lower your risk, make sure you don't get shot in the chest with a taser, because that is more closely associated with cardiac arrest and sudden death. When used up close, the stun gun mode can cause a great deal of pain, like a cattle prod. Now, if after exposure to projectiles someone is persistently confused, unconscious, then they certainly do need to have emergency medical attention. Now let's talk about pepper spray and tear gas. These are types of aerosolized materials that can irritate the eyes and mucous membranes, especially pepper balls, which are basically paintballs filled with pepper spray, and tear gas, which are particles released from a canister. Now, both sprays can cause eye burning, vision problems, difficulty breathing, especially in sensitive airways. So remember those ABCs before moving forward. If you've established that the victim is stable, if there's any eye redness, irritation, eye pain, swelling of the eyelids, blurred vision, inability to keep the eyes open, or a feeling of a foreign object in the eye, then they may have been exposed to a chemical irritant. So the first step to address the situation is to decontaminate, and make sure you do that in a safe place where you are not further exposed to the material. And that means getting rid of any clothes that have been exposed to it, get rid of any contacts that you're wearing and throw them away. Wash out your eyes with saline solution for at least 15 minutes, or plain water if that's all you have. Baby shampoo can be used to remove some of the oil material. If you continue to have eye pain after an injury, a sensation of a foreign body in the eye especially, you'll need to have a proper eye exam, as you may have further injury, such as a corneal abrasion. Now let's move on to more everyday first aid. Now lacerations are quite common. It's cuts, scrapes, and abrasions. We've got to look at the C in ABCs, of course, as we always do. Circulation is important because if there's bright red pulsatile bleeding, the victim could have a great deal of blood loss quite quickly. Apply direct pressure to any laceration. Apply multiple layers of gauze or cloth if it keeps bleeding through. And if there is continuous bleeding after 10 or 15 minutes, there's persistent loss of consciousness, there's confusion, the person is cold and clammy, then they may be in shock and need emergency medical attention. For more minor wounds, you can of course move on to irrigation. That is using a powerful stream of water if you can to wash out the wound of any impurities. That's that mechanical action that gets the contamination out of the wound. Apply a bandage and antibacterial ointment if you can. And you want to keep that wound moist. You actually do not want to have wounds exposed to the air because you may have a worse scar in that case. Do you need stitches? Well, if the wound is more than a ½ inch long, if it's really deep and gaping, ragged edges, contaminated with glass or gravel, you may need professional attention to get stitches. Now, anytime you have a wound, you want to take a look at your tetanus status. When was the last time you had a tetanus shot? 5, 10 years ago or more? Do you not remember at all? You'll need a tetanus booster. Now, let's move on to musculoskeletal injury, specifically the shoulder. The shoulder is a great joint, lots of range of motion, but it's also relatively unstable for that. So it's exposed to injury from trauma, from falls. There can be inflammation of the tendon. There can be tears in the tendons from those acute injuries. There can even be a fracture of the upper arm bone called the humerus. Now, a proper shoulder evaluation requires a physical exam, but if you're out in the field, see if you can move your arm up to your head. See if you can comb your hair with your hand. Is there pain when moving your arm up against resistance? That's called abduction, and if so, there could be a problem with your rotator cuff. Now, in order to stabilize your shoulder and immobilize it until you get definitive care for an acute injury, you can apply a sling using a t-shirt, just like this. You can roll your shirt up over the elbow, and it'll hold it in a good place until you get care. Now, it's summertime, so heat-related illness is certainly possible. If someone collapses, does have a pulse, feels warm, has a fever, heavy sweating, rapid pulse, they may have even fainted, complained of muscle cramps, they could be on the spectrum of a heat-related illness, whether it's heat exhaustion or even heat stroke, which is life-threatening. They need to be hydrated and cooled. Now, the risk factors for heat-related illness are, of course, the weather, that's high heat and high humidity specifically, the extremes of age, whether the young or the old, and medications, being on multiple medications, using recreational drugs. Those don't allow the body to give off heat fast enough. Now, if there's any neurological symptoms on top of what I've mentioned, such as vomiting, seizures, persistent confusion, then there may be a heat stroke, and you should call 911 to activate EMS. This requires rapid cooling. So if there's any ice cubes, ice water, fans, ice baths preferably, you want to cool the victim as soon as possible until they're actually shivering, until definitive care arrives. We hope this is helpful to you and those around you to stay a little bit more safe out there. Thanks for watching.